Aaron, would you, from your theater experience and your experience with this program, give me some very concrete concepts for what you teach these doctors that come from the theater tradition? What do you teach them to do?
Well, there's a number of things. On stage, for instance, you want to turn towards the audience so that they can see you and they can hear you. But if you're in a doctor's office, quite often the doctor is turned away from you. He or she is writing on a tablet or typing at a computer, and as you're talking, they may nod, they may not nod. You're just not entirely sure that they are even listening to you. And when they talk to you, maybe you don't hear everything that they say. That can be taught in a matter of minutes. But at a deeper level, there's this old belief that acting is about lying. But in fact, in acting programs today, what we're actually trying to teach is authenticity, to be present in the moment.
I think Aaron's exactly right. If you think about the classic vision of a doctor, I mean, you have the white coat, you have the stethoscope, you have the chart, and there's all those things in a sense are putting a little bit of a barrier between the patient and the doctor. And part of this is just taking down those barriers and creating an openness so that people can exchange information back and forth in a free way. It's also a lot about self-awareness. A lot of these people that we were teaching were young physicians, people that are 26, 28, 30 years old, and understanding who you are so that you can find that connection between you and the patient is a big part of this. And that's probably even the hardest part. And that may be the reason why as doctors get further along in their careers, they understand themselves better and therefore they can relate to patients better.
Right.
You know, I mean, I take care of a lot of patients who are people that have had very, very difficult lives. They come from a very impoverished background. They don't have much education. They have IV drug problems, lots of things that are just very far from my own personal experience, and I have to find a way to connect with them. And doing that takes a lot of work on my part to try to understand where they're coming from and relate their tough experiences with experiences I've had in my life.
What did you learn, for instance? What thing can you remember you specifically added to your repertoire in interacting with a patient?
Yeah, well, I actually don't consider myself that empathetic of a person, and I've always admired those people that have those natural empathy skills. They're very extroverted. They really have this joy of talking to people, and I think I come from much more of the maybe even more classic physician background in that I'm much more sort of scientific and set back a little bit. And watching these guys interact, one of the things that I've learned a lot about is vocal presence in terms of how to use your voice to mean different things with a patient. One of the things that Aaron and I have talked about is you have a very small way of using your voice and a very big way of using your voice. And being able to use that skill to where you're having a big conversation with a patient where you're talking about medical diagnoses in these very confident terms, and then make it smaller again so that you can get back to this caring, empathetic, sharing kind of intimate relationship is a real skill, and it's something that I've been working on trying to use with my patients. Well,
and if I can say, actually, Alan is an empathetic person.
I can tell.
Well, he may just not be naturally expressive in his empathy, and a lot of these doctors actually most of them are naturally caring people. You don't go into medicine, especially primary care, especially internal medicine, without having a desire to help people. Many of them know quite a bit, but perhaps aren't able to articulate how it is they do what they do. But in the theater, we break it down into concrete things that you can do to improve your empathy, to improve your presence, to improve your connection to other people.
One of the best things that I learned from a colleague of mine was he looked at me one day and said, "What else is bothering you?" And he just had this sense that there was something else going on, that there were other things that I was, worried about or concerned about. And that's a skill that I've tried to take to my patients to be able to read, okay, well, there must be something else going on. I can sense that.
There's a much deeper thing that's going on, which is a fear that this means something different, a fear that I'm going to lose something in my life that's important to me, a fear that I'm not going to be able to accomplish the things in my life I want to accomplish. For instance, I had a rock climbing accident when I was in the Army, and I shattered both my legs. I spent a year in a wheelchair. I kept my own fears about whether or not I would ever walk again. Will anyone ever love me? Will anyone care about me? These are fears. These are real fears that were never addressed because I was never able to have the courage to ask these questions, and the doctors were never able to recognize that those were the real fears I had.
Surely they knew those were the fears you had. They couldn't cope with what to say in response to them.
No, some of the doctors knew, and some did not. Some of them acted on those. There were people in other beds in the ward that were going through similar things, and I saw the physicians or the nurses that would take the time to talk to them about the long-term impact of this on their life and make a connection. These are soldiers, and there were the physicians were also soldiers, and they made that connection on that level. That I understand this, and I've gone through something like this, and it helped so much.
There's a lot of really great literature written by physicians who practice medicine for 10 years and then get sick with something that's life-threatening, or they spend a lot of time in the hospital, and they go through this whole process of realizing what it's like to be a patient.
So is this something that Virginia Commonwealth University is going to apply to its residency or medical program?
What we're trying to show in this most recent study is how the study affects patients and what patients feel about it. And what we'd like to do is be able to take this curriculum and teach doctors throughout the country about it. One of the things that's happened with medicine and with medical education is that we're so focused on PowerPoint lectures and what's going on under the microscope and things like that we're not doing as much stuff about just doctor and physician interaction.
Aaron Anderson is a professor of theater at Virginia Commonwealth University. Alan Dow is a doctor of internal medicine there. For the frail and the chronically